We are back on MorningLine. Thanks for joining us. A fascinating program this morning, talking about chronic pain and hypnosis. And boy, as we were talking during the break, there's so much more that hypnosis, under the proper conditions, might be able to help you with beyond chronic pain.
Yes.
And with us, so this is Dr. Lindseday Mckernan, and also with us is Steve Olson. He's one of her patients that's dealing with pain through hypnosis. All right, so when we went to the break, you were describing how, for instance, today you're with us and you're not feeling a lot of pain. What is your routine? You have tapes, you said, of her, or I guess her voice telling you where to go and putting you into that near sleep state. How many hours a day, or do you have to do it first thing when you get up in the morning, and does it last all day, or how do you maintain?
I usually do mine somewhere around mid-afternoon, and then maybe evening before I go to bed.
Just to reestablish it?
Reestablish it. And the other time I do it is if I happen to go outside and do some work around the house and it flares up the pain, or I'm walking a lot. If I'm out shopping, something like that, I can go back to the car, sit down, put the tape in, listen to it, and I can get up and go.
Wow.
2 hours more.
And how long is it, a little session when you listen to the tape?
20 minutes to a half hour.
20 minutes to a half hour, but you're up and you're just telling me that you don't feel the pain the way you once did.
No,
and
I actually went through one session where we were doing this, and Dr. Mckernan actually told me, think of like a volume control button, and turn the pain down or turn the pain up in your legs. And when I went to turn it up, I actually became fairly emotional. That
you can do that. You can crank the pain on if you want, which you wouldn't, of course.
If I turned it up too far, I mean, it brought tears to my eyes instantly.
Yeah.
And that's his brain doing this, that he's able to control.
So the brain, when it's in pain, there's not just one place in the brain that's affected. It's a network in all these different areas of the brain, and the brainstem and the spinal cord. So they've actually done studies where they've done hypnosis in MRI machines.
Okay, to see what part of the brain? Okay.
And different types of suggestions affect different areas of the brain. Because there's a part of the brain that tells you how bothered to be by pain, so whether or not you're getting tearful or reactive. And there's another part that tells you whether or not it's hot or cold. So certain suggestions that are directed towards each thing activate that part of the brain. So it is like talking to the brain in some ways.
Okay, and again, are there a lot of patients, you see a lot of them now? I'm just wondering, it just seems to me like that it's something that anyone in his situation, and there are thousands and thousands of you in Middle Tennessee alone, would give this a try. Right now, is it becoming that way, or is it still something that's relatively unique for someone like him?
Well, part of the reason I started a group clinic is because I got on a 6-month wait list to be seen individually. Okay. So then we started a group clinic, and then that got on a wait list. So I've started a training program with interns and postdoctoral residents and practicum students that have learned how to do hypnosis. So now I supervise their doing hypnosis. And we're running 2 groups and individual clinics, so we see up to 40 patients a week for hypnosis.
40 patients a week, and again, once they let's maybe go through the process. Then when a patient like him comes, someone watching today may say, you know what, I want to give this a try. So they come by the Osher Center, and say, I'd like to look into hypnosis. So how does it go? They fill out a questionnaire. How does the process go?
So whenever you're seen at the Osher Center for an initial appointment, it's with a medical provider. So you talk about that with your medical provider, and then they refer you to me.
Okay.
And we have a system where we have a rolling wait list because of how many people are referred, and we make calls when groups start. We have at least 1 group every 8 weeks. I'm running 2 right now.
Okay.
And in terms of the individual sessions, that's on an as-available basis.
Sure.
And if you can't make groups, if the time doesn't work with work schedule, sometimes we can work you in.
But the groups,
one-on-one.
I have this vision of a nice calm room, and everyone's sitting in comfortable chairs, and you're talking, and then you try to put them
Sure, then we have sort of yoga mats and pillows, and we lie down and do a practice.
You could either lie down, you could sit in a chair, you could lean against the wall.
Yeah.
Whatever works for you. And now you did private sessions, I guess, right?
I've done both.
You've done both. And a group session is okay, right?
And to see anywhere from 8 to 12, 14 people all be hypnotized at once.
Yeah.
It's just absolutely amazing.
Now, when you're actually hypnotized, as you said, you're still conscious. Is there a point then where you snap out of it, or because you said at some point he has to do it on his own? How does he come out of it? Or
And you're not asleep. That's one of the misconceptions about hypnosis. It's not sleep. You can hear me. So it's sort of like when we were talking about that state right before you fall asleep. You're aware of what's going on. You're just incredibly relaxed.
Right.
So the tapes they walk you out of it, just like they walk you into it. As do I.
Okay.
When
I
I see you, I don't
tape.
snap my fingers and then things are changed. That's not how it goes. And when you learn how to do it on your own without a tape, which is also possible, you learn how to walk yourself in and out of it.
That just really sounds like meditation to me in a way. I mean, a deep, very, I don't know, transcendental I don't know meditation, but it just sounds like when you do it on your own, it's just you and nothing else. There's no medicines, no pills. It's just you in that moment, what you're thinking about, and taking your brain there, right?
And giving yourself suggestions.
And giving yourself suggestions. What is when you say, can you give me an example on the tape? I mean, what is the suggestion you're saying? Okay, I'm in that state, and you're saying, okay, now let's relax.
So a suggestion might be that you are allowing a sense of cool blue liquid to move from the top of your spine all the way down to your toes and run through your body.
That's supposed to ease the pain, maybe.
Might be a certain area of your body that's hurt. You mentioned earlier that your shoulder was hurt, so it might be that your shoulder,
it goes to your shoulder,
that it goes right to your shoulder, or that if your shoulder's been feeling really tense, it might be a sense of heat or warmth, or like bathing in warm water.
Okay, so you're saying these things. Just hearing your voice, you've got a calming voice. I mean, you hear and they're very pleasant images or feelings. So you think about that, and then how long does it take? A minute, 2 minutes, 3 minutes to get to that point, and then really address the pain? So
when you start, it takes a little longer to get there, probably a good 20 minutes. Over time, when you train yourself, when you're this disciplined, which I think a lot of what we're talking about with this kind of success has to do with Steve's discipline. He's been doing it every day.
For how long now?
Faithfully.
2 years.
2 years, okay.
And you can get to that relaxed state in less than 2 minutes.
That quickly?
Yes, because it's like a stimulus response.
Sure.
Your brain knows where to go. It's been trained and it knows what to do. So you're just helping yourself.
Okay, so you can get to it that quickly, and then you stay. And at what point do you actually address the issue of the pain? Or like he was saying, can you say to yourself, all right, now imagine that cool fluid going through you, and then do you say something about dialing down the pain?
All kinds of things. So in the group sessions, each week focuses on a different type of suggestion.
Okay.
Because we found that it's not just one suggestion that helps somebody with pain, because so many different areas of the brain are affected. You've got to go to a lot of different places. So you learn what's good for you over time. It might be that the cooling liquid has no effect on you. It may be that you actually would like to take your mind through pleasant memories in the past. Or you might like to think of yourself in the future. Whatever it is, you'll find what works, and that's what you use. It's really just individualized at that point.
Is it true then, too, that some people maybe are more prone to be able to be hypnotized than others for whatever reason? You've said that you have to be willing to begin with.
Yes.
If you don't want to be hypnotized, someone's not going to be able to get you. But I mean, are some people just more prone to be hypnotized?
Yes, and I can't really tell you any specific factor aside from the fact that they know that it's probably genetic and handed down in families. So there's a normal curve. So everybody is responsive to hypnosis to some degree. It might be that some of us are more responsive, and when you are, those perceptual changes that we're talking about can be incredibly powerful.
Okay.
Those of us who are a little less responsive, you can still become incredibly relaxed, which can help you with pain. And it can help your mood and energy levels. So in a lot of ways, there are benefits beyond pain relief over time.
Just a tangible question that I know viewers probably would think, is this something that insurance will cover?
Yeah.
It does, because some, I don't know if insurances don't always cover like chiropractors or acupuncture, which I know helps a lot of people, but what about hypnotism?
So in terms of insurance, when you have a medical condition, most of the time psychological services that you receive as a result of the medical condition are covered. And hypnosis falls under that umbrella.
Yeah, but how long before Big Pharma starts attacking you because you're taking money out of their pockets? Oh, you laugh. Those meatballs are going to keep doing it. They don't like it. Big Pharma, they want those pills out there. This guy, when's the last time you took an opioid pill?
I haven't for 2 years.
That's unbelievable. And it's based on, don't you feel better?
Oh, 100%.
On so much.
There are days that I just so happy and thankful for everything, and just it's totally changed my life and brought me back around to appreciating things.
And the beauty of this is that it's a skill that you have inside of you, that you've had inside of you all along. So I'm not necessarily doing something magical. It's been there. So I'm just helping you cultivate a resource that you have. Everybody has it.
Everyone has it, and whether you can just choose or can tap into it is the key on all of that.
Right.
I mean, it's awesome, by the way, that you share your story like this to come out. I mean, now, I'm just wondering, is he your one success story? Could you have brought other patients?
Well, you've been in the groups. He's been in some groups.
I'm just saying. I mean, you obviously, it's worked great for you. I just want people to know that it, you know, I mean, you seem to have been able to tap into it, but others obviously have. These classes are growing big, right?
Yes, and it takes practice. So a lot of times, you've got to get into the classes and stay in them, because generally, towards the end, you start to notice differences just in energy levels or in pain flares and managing them, because pain doesn't just stay high. It can be elevated and then spike a lot of the time. So that's another thing that it helps with, is when it's escalating, you can go and you can choose how you want to respond.
So there's no way you can really do this, could you, for acute pain? Could a woman do this during a delivery?
Yes, happens all the time. In our first group, we had 2 pregnant women who used it for their labor.
As opposed to an epidural? Or did they still, I don't know if they used one or not, but did it help them?
It could.
I was just wondering if that, because that's an acute pain at that moment, and I'm just wondering if that maybe meant they didn't need as much of a painkiller or something, I don't know.
So a couple of things. As long as you know how to do it first, it can really help. So you can't just decide in the middle of labor that you want to try hypnosis. That would be like learning how to drive on the interstate.
Okay.
But it can really help with reducing procedural discomfort or things like labor pains. There have been tons of research studies on hypnosis for labor pains.
Okay, I guess that makes sense. Would you think you could try doing it if you went to the dentist for something on their mouth? Like, I don't know if you have, but if you went, let's say they said, well, you have a cavity here, we're just gonna have to drill a bit, you might feel a little pain, do you want some Novocaine? Do you think you could say, give me 20 minutes here, let me focus, and let's do it without the Novocaine?
I absolutely feel I could do it.
Yeah, I get a lot of my referrals from dentists for people that are afraid of the dentist.
Well, those needles that they give you the shot with are no fun.
Right,
if you could avoid that.
Or TMJ. So there are conditions where your jaw gets so tight that your teeth break.
Yeah, I wear a mouth guard.
Yeah, so there's someone that I worked with, she had broken her 4th tooth and then came to hypnosis, and she hasn't had any problems after doing hypnosis.
But isn't it, really? Because a lot of the grinding of the teeth, at least for me, and I do wear a mouthpiece at night. I'm under stressful job sometimes. It's subliminal. I'm not thinking about grinding right now. It's like I'm asleep at night, and apparently I like to crunch my teeth. Right? So a hypnotist, that can tap into the subconscious grinding effort thing?
Yeah, and you could do it right before you go to sleep. So in my experience, it helps with that tension in your jaw that's probably already there right before you go to sleep, of loosening it up so you don't go into sleep in that stress state. And a lot of times if you're waking up because of jaw pain, it could help you get back to sleep and relax your jaw.
Wow. We're going to take a break on this. We've had calls, but I wanted to ask you my questions. When we come back, we'll get to some of the phone calls if you have questions or comments for our guests. A fascinating conversation. We'll be back right after this.
This is